everyone, my name's Jackie Jones. I'm a Senior Project Manager in the Welsh Ambulance Services, also known as WAST. And Andeep works in the Service Improvement Department. So initially, when we first started this project, Andeep and I worked in separate departments. They sound very similar because one was quality improvement, one was clinical improvement. So it made sense really that we joined together to work on this project. Andeep's the Service Improvement Officer and currently does all the work around data collection and information. So the first slide then, it all started off really, I think like a lot of organisations, we had projects going on all over Wales because obviously the ambulance service covers the whole of Wales. Lots of projects were being repeated and we didn't really know what was going on. So the executive management team set the challenge of crediting a trust-wide process for improvement and innovation. That was for the intermediate medium-term plan, which was 2017-20. Really just to bring everyone up to date really with improvement and innovation, and to try and establish some sort of network to support colleagues and to make improvement and innovations. And it was decided that a digital portal could be developed for staff to submit their ideas and project proposals. So we'd sort of done similar things before, and if, in all honesty, was not quite sure, you know, if it would work this time round, but was going to give it our best shot. So this portal was then launched 25th of March last year, and it's been accessible to all staff throughout WAST on the intranet. So the next slide. Well, I put project journey and it looks very simple and straightforward. Obviously, there was a lot more to it than that, but sort of the main steps, I guess. And step one really was to try and, well, plan. So we needed to plan what we was going to do. Within the improvement group, it was decided that a small project group should be brought together. And this is, as I say, where me and Andeep sort of came together across two separate departments and obviously brought other people in where we worked on this as a project. So plan. Step two, develop a WIN framework. Well, the WIN group, as I say, was the overarching steering group, if you like, for improvement and innovation. It was a very large group, very senior, and it had sort of buy-in really from across the trust, which had its sort of good side and its bad side, because it could become a little bit of a talking shop. And I think this is why we needed a small project group to take this specific area forward. So we had to develop the plan within the WIN framework and all the objectives around that. The large part really of the time, the part that took up most of the time was to develop the platform process, and this took quite a few months. You sort of think, I might stick up a form on the intranet and people put their ideas in and it's sort of as simple as that, but it was actually quite complicated. We needed to sort of decide how people were going to put forward their ideas, who was going to decide whether they're good ideas, whether we could take them forward, and what experts we needed and so on. And this has been sort of adapted throughout really. We've been tweaking it and sort of being quite flexible with it. So that, I think that's been a really crucial part. We obviously had to test it. So we did some PDSA cycles, which were very much sort of feedback from staff. We got staff to fill in the forms. We asked feedback about the website. And got some really positive feedback and again tweaked it as we went along. Communication engagement needed mentioning because it obviously was a really important part, because again we've got a large trust, it's spread out throughout Wales, and lots of members of staff are based on ambulance stations in the middle of nowhere. They're always out, they're always busy, they don't always have internet access or email access. So we needed to link in, work very closely with the communication team. This was a part of the plan at the very beginning as well, how we were going to do that. And what didn't help either was that the communication team at the time was one person, and we had a new chief exec, so she was helping him a lot as well. So that was quite challenging, but she did a great job, and we went forward with that. So then we'd sort of hopefully had everything in place. We went live and we launched the WIN on the 25th of March. Again, communication was a big deal. We all went out, we went to ambulance stations, we had leaflets, the main headquarters and the control centres. We put up banners and spoke to staff and went into departments. Really, really important, I think, to do face-to-face. Again, difficult when we've got such a large area to cover. And then we closed the project as a project and went forward business as usual from there. We did a project report. We tried to get everything into there, and we've shared that with colleagues as well throughout other trusts. And then really, if the project was successful, and I've just put an app because that was one of the things we needed to learn lessons from this, how we'd do it differently, and how we could move forward from there really. So the next slide just shows an example of the WIN platform. So it's on our intranet site, and that's sort of how it looks at Contact. And we've got all areas people can link into, obviously resources, improvement plans. We've got portfolios for the IQT Silver projects because they submit through this platform as well, and resources they can get through there. We've got how to submit ideas, which is the application form. And trying to make it as simple as possible is quite difficult, isn't it? You can make it as complicated you like, that's easy, but making it simple for people, and it is a very basic form. Project A is just an ambulance service initiative that we've been working with, so they can go and get information. And quarterly performances. The PPM framework is project and programme management framework, which is sort of separate, but links in with this, and that's mostly around more formal sort of Prince2 style projects, and they've got templates and things staff can access if they're going down that route. So the next slide, please. Thank you. And this is basically, yeah, carry on, Andy. Thanks.
Should I take over from this one? Yeah.
Yeah, super.
Brilliant. Thank you, Jackie. As Jackie said, it was really difficult planning the process. To try and make something as simple as you can is quite difficult. So this is the process we came up with and we followed. So if you see there, once an idea is submitted, a team of experts meet once a month to review ideas. This review is conducted via a score and matrix template. We look at whether the ideas come under any of the healthcare standards, our 5-step model, or if there are any financial implications or risk associated. Then the ideas are generally categorised as, for example, just duets, audits, research studies, or improvement projects. Through the audits and improvement projects, staff have the opportunity to undertake Silver IQT training. The ideas can also be signposted to leads if the ideas relate to an initiative or programme of work already agreed or being delivered. Ideas that do not currently align to our trust priorities or objectives are placed within the ideas warehouse and reviewed during our yearly planning cycle. Also, ideas that have been previously tested or implemented within the trust are also recorded within the ideas warehouse for information. So that's the process. The next slide is just some of the measures we've agreed. This process has allowed us now to collect meaningful data that we were previously unable to do. This includes the number of staff that we've had access to the portal, the number of ideas that have been submitted, number of staff who have undertaken Silver IQT training and completed a Silver IQT project. Other key measures are around the key themes and trends and the number of ideas that have been received per department. Staff undertaking an improvement project via the Silver IQT programme are required to complete a portfolio of evidence. So therefore, we have a unified process in place for all staff to follow, which includes all the relevant information that we may require to make a case for change. So the next slide then is next steps. So prior to COVID, as Jackie mentioned, we were in the process of looking at an app and also digitalising our performance dashboard with the relevant meaningful data that staff could, trust leads could access. So to determine the key themes and trends in real time. But unfortunately, this work was temporarily stopped due to the pandemic. During COVID, we adapted the process. The portal was still open for staff to access to submit ideas, which continue to be recorded, but only ideas in relation to COVID were reviewed and passed on to the relevant trust leads for consideration. Learning during this time period has been reviewed, and we are now in the final stages of adapting the WIN process. And once agreed, we can then revisit digitalising the performance dashboard as previously planned. The Trust has now also implemented a new intranet site via SharePoint, which allows staff to continue to access the portal via their computers and laptops, and now also via smartphones and via Trust-issued tablets remotely. Although this has reduced the need to develop an app for staff to access the portal from anywhere at any time, we still plan to explore this option once COVID is under control. We have also been approached by Cwm Taf, Morgannwg Health Board and Scottish Ambulance Service, and we've shared our report, end of project report, with them, and they are quite keen to replicate the process we have in place, and we continue to engage with both organisations and share the learning.